Good morning, Mr. Miller. How are you feeling today?
Good morning, Dr. Thompson. I've been better, to be honest. I've been experiencing some troubling symptoms lately.
I'm sorry to hear that. Can you describe what you've been experiencing?
Sure, I've been feeling extremely tired even after a full night's sleep. I'm short of breath, especially when I try to do any physical activity, and I've noticed some swelling in my ankles and feet.
EC. How long have you been experiencing these symptoms?
The fatigue has been going on for a few months, but the shortness of breath and swelling started about 3 weeks ago.
Have you noticed any other symptoms, such as chest pain, dizziness, or palpitations?
I have felt some chest discomfort, but it's not exactly painful, more like a pressure. And there have been times when I felt my heart racing for no apparent reason.
Thank you for sharing that, John. Before we delve deeper, can you provide me with a bit of your medical history? Any previous heart-related issues?
Well, I was diagnosed with high blood pressure about 5 years ago, and I've been on medication for that. I also had a mild heart attack 2 years ago.
Understood. Are you currently taking any medications for your blood pressure or any other conditions?
Yes, I'm taking lisinopril for my blood pressure and atorvastatin for cholesterol. I'm also on aspirin since the heart attack.
Any allergies to medications that you should be aware of?
I'm allergic to penicillin. I had a bad reaction to it as a child.
Noted. And can you tell me a bit about your family history? Any heart disease or other significant medical conditions in your family?
Yes, my father had a heart attack in his early 60s and my mother has diabetes.
Thank you for that information. Based on what you've described and your medical history, it sounds like you might be dealing with cardiomyopathy, which is a disease of the heart muscle that can lead to heart failure.
That doesn't sound good. What exactly does that mean for me?
Cardiomyopathy means that your heart muscle is weakened and is having difficulty pumping blood effectively. This can cause the symptoms you are experiencing, such as fatigue, shortness of breath, and swelling.
What causes this condition?
It can be caused by a variety of factors, including high blood pressure, heart attacks, chronic rapid heart rate, or underlying health conditions like diabetes. Sometimes it can also be due to genetic factors.
What do we do next?
First, we'll need to run some tests to confirm the diagnosis. I'll order an echocardiogram to look at the structure and function of your heart, and an ECG to check for any abnormal heart rhythms. We might also do a blood test to check for biomarkers that can indicate heart failure.
Okay, that makes sense. And if it is cardiomyopathy, what is the treatment?
Treatment usually involves medications to help your heart work better and to control any contributing conditions like high blood pressure. We might prescribe beta blockers, ACE inhibitors, or diuretics. In some cases, lifestyle changes such as diet, exercise, and quitting smoking are also crucial. Severe cases might require more advanced treatments like an implantable cardioverter defibrillator, ICD, or even a heart transplant.
That sounds pretty serious.
It can be, but with the right treatment and lifestyle changes, many people manage their symptoms effectively and live full lives. We'll work together to find the best approach for you.
I appreciate that. What's the next step?
I'll have my nurses schedule the echocardiogram and ECG for you. Once we have the results, we can discuss the best treatment plan. In the meantime, keep an eye on your symptoms, and if anything worsens, come in immediately.
Thank you, Dr. Thompson. I'll do that.
You are welcome, John. Take care, and we'll get through this together.
Thanks, Doctor. I appreciate it.